Time for the Pat and Aaron Show injury report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. I don't want to put the pressure on Dr. Sellman, but this may be the most important injury report we've ever had. Maybe not. We'll see. They're all important. Dr. Sellman, welcome to the show. Welcome back.
What's up, brother? Thank you. And thanks for that pressure, man. Now I feel like I'm going to wet myself.
Listen, and that's it. I understand because we're all feeling that way. We felt that way after Monday night. And Chris Godwin dealing with that gruesome ankle dislocation and happening at the end of the game, just adding insult to the injury. So what do we see here? Because he is in a contract year. He was going to get paid big money. But what injury are we looking at? Is there a chance we heard maybe if the Bucs made it far enough, he could potentially give it a go? What are we looking at here, Dr. Sellman?
You're absolutely right. A gruesome injury. It's actually relatively rare of all the ankle injuries that we see in the NFL. An ankle dislocation is what he had, and that's where the three major bones of the ankle joint basically go out of alignment from one another. And if you can imagine, if your bones are held by ligaments, those ligaments get pulled and torn as your ankle is twisted, then you're going to break those bones, and that's why he had surgery. In fact, 99% of the time you get an injury like this, you're going to have multiple broken bones.
I don't know if you looked at it because I know they didn't show it on TV, but if you watch it, was making the rounds. There was a hip drop tackle, and Smith, the defender, came down on him. Did that add to the injury?
You know, that's actually why it has been banned by the NFLPA this year, and it just shows exactly how much force when that player just wraps around Chris Godwin in this case, brings his feet, basically jumps off the ground, and then pulls his entire weight, and his whole body came on that ankle. Godwin didn't have a choice whether to get that dislocated or not, and that just really wreaked havoc on that particular ankle. And this can lead to the question about whether he can come back. There is a very small chance, but typically we see at least 6 months out for the season, and we know, he's a free agent next year, and, that just puts a lot of pressure on the entire organization.
Because speed is a big part of it, agility, being able to cut. I know it's hard to tell, and you haven't looked at it yourself, but is it going to be hard to regain this form?
It will be, but up to 70% of the guys that come back from this will regain the form that they had before. But, he's looking at possible complications down the road, especially with the post-traumatic arthritic changes and the pain associated with that later in life.
Okay, arthritis. I'm starting to feel it in my fingers a little bit, Dr. Sellman. I think. My knuckles hurt. I'm 34. What do I do? What's going on? I'm sure a lot of people are in the same boat. I don't know what's going on. Maybe it's the keyboard or the phone, but my knuckles are hurting. It's specifically my left hand.
Well, it depends on what you use that left hand for.
I'm a righty.
Course.
I'm a righty, Dr. Sellman.
Right.
Thank you very much.
Not the stranger danger. You're welcome. With the small joints like that, you want to look at other kinds of arthritis too, especially in someone young, like a rheumatoid arthritis. It's kind of rare in a male, but what we see now...
You don't know me, Dr. Sellman. Some would argue that I am that.
You're right. I mean, just on paper, it looks like when you fill it out. But other than that, who knows?
But yeah, I feel it. I don't know. Okay. All right. Enough about me. Is there something I can take or rub on this? I don't know.
You can always rub something on. But you know what is actually really good? Obviously, keeping the small muscles strong around the fingers is very important. So just the stress ball while you're sitting there on the show even or while you're talking to me on the phone and using some kind of anti-inflammatory. I prefer natural long-term like turmeric and ginger and all that kind of stuff. And over-the-counter Voltaren gel seems to work very well, too, for the small joints in the hands.
All right. Thank you. And anyone else dealing with that out there, that's a good piece of information from Dr. Sellman. Mike Evans re-injured that hamstring. It was hurt. We knew it was hurt. Scored a touchdown. Saw on the sideline he was laboring. Went back in there, and now it's going to be probably until after the bye week we see Mike Evans again. What happened there? How did he re-aggravate it? What did you see on that missed touchdown catch that led to that?
Yeah, it looked like he pulled and kind of extended that knee a little bit to pull on that hamstring. And when it's already inflamed and injured, you've got a little bit of fluid in there, and it just compromises the muscle belly itself. And so it's very common for especially hamstrings. Those things can last forever, and it's difficult from a medical perspective because personally, I really rely on the testimony of the athlete. And here is a professional athlete who's chasing his 11th straight year of 1,000 plus pass yards and just was getting ready to pass that 12,000 mark. So there's that pressure to get him back in. And if he says, we're good and he's running pretty well, then we're going to put him back in. But there's a possibility this could happen. Unfortunately, it did. So I believe he went an MRI yesterday to see kind of the extent of the damage to kind of direct the therapy from here.
Dr. Sellman, changing gears here, looking around the league. Jayden Daniels had the rib injury last week. X-rays came back clean. What type of injury to the ribs are we looking at here, and what can we expect from him moving forward with the injury?
Unfortunately, especially with ribs, a lot of the time those X-rays can be, they're clean. It's very important we get these certain views. We have people breathe rapidly when they're just turned about 30 to 45 degrees to see if there's any abnormal motion in those ribs. So even though the X-ray came back clean, it could still be a stress fracture or a fracture. CT scan usually is the best to, look at that. But what we're looking at is possibly chest wall contusion, or the muscles that kind of attach the ribs to one another could be strained, or a cartilage injury itself too. And that is just a difficult injury, especially for a thrower, because it helps stabilize the shoulder, and just taking some breaths can be extraordinarily painful. So it's kind of a day-to-day basis, and having him take his own deep breaths to try to keep those lungs expanding, because we got some important organs underneath those ribs we've got to protect.
Yeah, and he's been playing so well, so it's going to be interesting to see how much that hampers him moving forward here. I want to sneak a couple more in quickly here before we let you go, Dr. Sellman. Deshaun Watson, Achilles, he's obviously done for the season. He's getting up there in age. What do you think? He's never regained his form since he came back from the suspension and all those other injuries. Does it look like he's kind of done now with this injury?
Man, I'd have a serious talk with me and my family if I were in the same boat, because ACLs times two, all these fractures, and now this rupture of the Achilles tendon that can just hamper his performance for the remainder of his career if he chooses to continue going on. It's unfortunate the number that actually has increased significantly in the NFL over the past 25 years, and there's debate as to why.
Tua Tagovailoa, it looks like he might get the start, probably going to get the start. He was practicing limited in practice yesterday. I mean, what do they do about this? How do you protect a player from himself? What do you think they should do? I mean, it's a very tough call, Dr. Sellman, with these head injuries, but we all saw and we've all seen what he's gone through on the field, and it's not pretty.
No, it's not pretty. Each time it appears to be very scary for everybody involved in looking at it. And, that's a tough question. He's a grown man. He chooses to come back. It's our job to give him some protection and possibly get that new concussion helmet that they have approved for the players to wear to decrease the force. That could be an opportunity to help protect him. But ultimately, he's had several. And his brain's like, you know what, dude, I am not ready to do this again. And if he gets even just a little bit of a hit, it could happen again.
It's really sad to see. I know we're all going to be nervous watching that game, watching when he first gets back on the field. The Pat and Aaron Show Injury Report, presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com, and you got free arthritic advice from Dr. Sellman today. So how can you beat that? Thank you, Dr. Sellman. You're the best.
Of course. I give a handy all the time.
He really is the best. You're the man, Dr. Sellman. All right, have a good week. We'll talk to you hopefully sooner rather than later.
Sounds awesome, man. See ya.
He's the best. Dr. Sellman always brings the heat here on the Pat and Aaron Show.